When it comes to COVID, some people feel symptom-free within days of testing positive, while others suffer for months.
Yeah, some researchers think that one thing that is fighting the virus is also causing the problem. News 9's Robin Marsh has more in today's Medical Minute.
We're talking the long-haul effects of COVID. Nearly 1 in 5 Americans who have had COVID-19 actually have what's known as long COVID. The CDC reports these long haulers experience symptoms of fatigue, memory impairment, and coordination problems that can last months, even years. Jeff Igman was one of the early ones to get COVID, and his symptoms stuck around.
The fatigue, I was really drained and could hardly get out of bed. I'm talking pretty good now, but early on I was trying to talk and I had trouble finding the words.
San Diego neurologist Jennifer Graves is leading a team tracking neurological symptoms in COVID long haulers.
What we've realized is shortly after the infection, in the first few weeks to months, folks complain of having headaches and fatigue. And then over time, we see a shift of folks complaining more about memory problems and inattention and difficulty multitasking.
They found 15 to 30% of long haulers' cognitive skills were impacted. Of 56 long haulers, 6 months after getting COVID, 2/3 still reported persistent neurological symptoms. The most prevalent, memory loss.
One leading theory that I think is very probable is that it's all triggered by the immune response to this virus. That even if the virus isn't directly invading the brain, it's triggering the immune system to behave in a way that triggers inflammatory response in the brain.
Health experts say effects of long-haul COVID can last up to a year, maybe even longer. UC San Diego researchers are now working to find biomarkers in the brain or blood that could identify which patients are suffering COVID brain in order to begin the treatment even sooner. For today's Medical Minute, I'm Robin Marsh.